So we're looking at ethical principles in health and social care. So we'll be focusing around the practitioner, like this person here. So the aim of the session is to support you in developing task 4. The objectives of this session are that hopefully by the end of watching this video cast, you'll be able to identify 3 key ethical principles and also be able to explain how these key principles are used in practice. And in doing this, we're working towards P4, which asks you in essay format to use 3 examples to explain how you would incorporate ethical principles into provision in terms of relevant support. And you need to think about examples from your placements. You really need to think about how these ethical principles that we're going to discuss here are used in practice. And if any of you decide to draw on some of your placement work, remember to change the names of people and ensure confidentiality of the clients. So we're focusing on this person, the practitioner, and what they need to consider on a day-to-day basis when practicing. So ethical principles when working in health and social care are things that professional practitioners use when they are faced with different situations that may involve moral dilemmas, and therefore it's important for health and social care workers to have a clear understanding of their professional morality. So we're going to look at what a professional's morality consists of a little bit more. So some of the key ethical principles that practitioners have to consider are their duty of care, are safeguarding issues, of beneficence, ideas around social justice. Professional practitioners need to empower the individuals and ensure that they are promoting dignity. So it's a lot for a practitioner to consider. So in terms of the duty of care a practitioner has when working with vulnerable individuals, all health and social care workers have a duty of care to protect their rights. If a proposed course of action or proposed treatment could be harm to an individual, practitioners have to weigh up the advantages or disadvantages of this. Possible example of what a practitioner may need to weigh up in terms of this is when treating a cancer patient. A lot of treatment can be quite harmful to the individual in terms of side effects. So chemotherapy makes people lose their hair, makes people very sick. The practitioner needs to weigh up whether going through a course of chemotherapy is more helpful to the individual's condition than harmful. Another issue that practitioners may need to consider is the idea of safeguarding, particularly for social care providers who should ensure that environments safeguard the vulnerable individuals that they work with. So in terms of this work, this could include recruiting new members of staff and providing resources to ensure that individuals' needs are met. So in terms of safeguarding, that could be ensuring that CRB checks are completed on all staff. When working in social care, there can be times and situations when the behaviour or actions of one individual could harm other people within the organisation. So this could be an individual with mental health problems who may become violent towards other people. So if this were the case, the social care professionals must follow organisational policy and procedures, and if the behaviour of an individual is likely to result in significant harm to themselves or to other people, then the individual may be restrained. So a practitioner would need to think of something like Section 5 of the Mental Health Act 2005, which provides guidelines for social care professionals related to the degree of harm that is likely to be suffered by a person if he or she is not restrained. So therefore that's a consideration for a practitioner. Another ethical principle that needs to be considered when working in health and social care is that of beneficence. Now, beneficence refers to actions to be taken that promote the well-being of others in a medical context. So this means taking actions that best serve the needs of the patients. And for social care workers, this refers to the duty to act in an individual's best interests at all times. This can involve balancing the benefits of medical treatment against the risks and also the financial costs. And what we do see is healthcare professionals quite often having to weigh up arguments over the cost of a treatment against the benefit of that treatment for that patient. A further ethical principle to be considered is that of social justice. Now, all individuals should have equal access to medical treatment and be fully aware of their legal rights, and practitioners have to make sure that relevant legislation is put into practice. So an example of this would be the Children Act 1989, states that local authorities must act in the best interests of all children, and that each child has a fundamental right to housing, healthcare and education. However, unfortunately, there are times when social justice is not available to all individuals. An example of this would be an asylum seeker's children who've just come into the country. A further ethical principle is that of empowering the individual. Empowering an individual means ensuring that they know enough to make an informed choice about decisions that could affect. So this helps individuals to take control of their lives, and it's the role of the practitioner to ensure that the individual who's a service user gets enough information about the options available to them. So the final ethical principle we're going to discuss today is that of promoting dignity, independence and the rights of the individual, which is very important when working with vulnerable people, especially when undertaking personal care activities. So an example of this would be a health or social care worker when supporting an older woman to bathe or dress. They simply make sure that the process is completed in a way that protects her dignity. They would allow the individual to choose their own toiletries, to choose their own clothes, and this way they're providing ways in which her independence can be encouraged and her rights recognised. So this concludes our current videocast in helping you develop your P4. So hopefully you now feel equipped to be able to discuss 3 of the principles that have been identified here in this videocast and be able to apply them to health and social care practice.